Hi, I'm Felicity, the Fit Injector. Welcome to my channel. If you're wondering why I'm red and bruised and a little bit swollen, I just had a PRP treatment, which is platelet-rich plasma. Now, super exciting, it's a Sunday here and I just got Cosmetic Nurse Jess in and we had an injector's play date. We treated each other and we played with the new machine behind me. So I am all ready to treat my clients with this exciting treatment this week. Now, we had the cameraman here, AKA the husband, filmed the entire thing so you guys can see what's involved in a platelet-rich plasma treatment. Let's check it out. All right, let's get ready for treatment. Step one is applying the numbing gel. We want to give this maximal time to take effect. Here I am applying to the under eye and upper cheek area. Those are the areas that I would like to treat today. Step two is taking the blood. Now, understandably, clients get nervous about this part, but it is no different to having a tube of blood taken when you have a blood test. Rest assured, we are registered nurses and we only plan on doing this once during your treatment. So things you can do to make sure that this is comfortable for both you and I is drinking a good amount of water prior to your treatment, and this part will be a breeze. Step three of the treatment is putting that tube of blood that we obtained into this machine, which is called a centrifuge. And what this does is it spins at a really high rate for 5 minutes, and that separates the red blood cells from the plasma. The awesome thing about this machine is it also pulls off this white buffy coat that you will hear me talking about during your treatment, and you'll see in this video that Jess and I get very excited about seeing that part when we pull it out of the machine, and that is the part that has all the good stuff in it. Step four, now that that blood has finished spinning, is you can see that separation of the red blood cells and the plasma. Now we need to draw out that plasma and also the white buffy coat and get that ready to inject that into the face. Step five is injecting the plasma. So here I am doing that to Jess's under eye and upper cheek area using the smallest needles you will ever see to keep you nice and comfortable. And the numbing gel has had a good amount of time to take effect. We are doing lots of little injections to get that into all of those areas. There will be a few stings every now and then, but what most clients report they feel is a bit of a warm sensation and also a little bit of, they can almost feel that plasma moving under the skin just for a couple of minutes post injection. You will notice there is some swelling, some redness and some little dots, and that is all a very normal response to that treatment, and all of that does settle very quickly. Now it's time to reset, swap over, and it's time for Jess to inject me with my plasma. And take note here how when Jess is taking my blood, I'm sitting up, I'm smiling, we're laughing about something. This is worlds away from what I used to be. 10 years ago, I was completely needle phobic. So yes, you can turn this around. To those of you out there who are watching this or can't even watch it because you are very squeamish when it comes to blood and needles, you can turn that around. PRP, or platelet-rich plasma, is best treated as a treatment course. So that's where you would do one treatment a month for a total of 3 months, and then it is recommended that you do one about every 6 to 12 months to maintain those results. Yes, you will see results after one treatment, but it is recommended that you do the course of 3 to get the absolute best results. PRP can be used basically anywhere, to the face, to the body, through the hairline, for skin rejuvenation. It stimulates your own body's collagen and elastin to rejuvenate the skin. Where I mention hairline, yes, it can be used through the hairline and through the scalp to help with hair rejuvenation. It can also be beneficial for scarring, for really dry skin, for skin that has a lot of lines and hollowing, to rejuvenate all of those areas. As this treatment uses your own body's plasma and we are not adding anything to it, it is really important that we are getting the healthiest plasma possible. So it is really important that you drink a lot of water prior to your treatment, that you do follow a healthy diet and try and avoid alcohol and high fatty foods prior to your treatment, so we are getting the absolute best plasma, therefore getting the best results for you. PRP can be used in conjunction with all your other injectable and skin treatments, and it really complements those treatments. Because it's stimulating all that collagen and elastin, it's actually going to help you to get better results out of your peels, your LEDs, your anti-wrinkle, your dermal fillers, all of those sorts of things. And the beauty is that we can treat in so many areas for skin rejuvenation. Think of it as your ultimate anti-aging treatment that's just constantly working in the background for you. The one where you look in the mirror in a few months' time or even a year's time and you think, gee, I'm really glad I did that because my skin looks so much healthier and plumper, and all my other injectables treatments are just looking beautiful. That is exactly what we want. Thank you so much for watching this video on platelet-rich plasma. I hope you enjoyed it as much as Injector Jess and I did. We had a blast. If you liked it, give it a thumbs up. If you're not subscribed, hit that subscribe button. Drop some comments below if you've got any questions about this treatment or the next treatments that you want to see. Encourage me to book more injector play dates because then I get more treatment. Thanks, guys.